Good morning, ladies and gentlemen. First, I would like to thank organizing committee for inviting me to give a lecture here. Today, my topic is the invisible aligner, changes to orthodontics today. I'm Yanheng Zhou from Peking University School of Stomatology and also Chief Orthodontist Sunny Dental Group. This is a self-introduction of myself. The invisible aligner is one of the two revolutions of orthodonty in 20th century. The second one is the test. The invisible aligner has changed the way how the orthodontist treats the patients. As we know, traditionally, the orthodontist treats the patient with various kinds of brackets, like standard edgewise brackets, back brackets, pre-adjust appliance brackets, self-ligating brackets, lingual brackets, etc., etc. But with invisible aligners, the orthodontist treats the patient without any kind of brackets, but a series of aligners. We can see from this photo, the way we use traditionally use the brackets and the wires. And this is the lingual brackets. And also here, we can see we have aligners. So clear aligners. So when the patient wears the aligners, you see it's more invisible. So that's the reason why we call the invisible aligners. From the photos, we can see the lady with the aligners. You couldn't see, even you don't know she wear the aligners. The invisible aligner has changed the way how the orthodontists work at the clinic. Normally, we restore a lot of orthodontic brackets, wires, and other auxiliaries in the clinic. But if we use the invisible aligners, no more storage of any kind of brackets, no more storage of wires and auxiliaries, no wire bending anymore. This is the 20-year-old female. You can see here, patient a convex profile from lateral profile, and from front view, we can see patient upper and lower lips protruded, also upper incisor and lower incisor proclined. Intraorally, you can see patient has full class 1 molars on both sides. The midline a little bit shift, and the overbite overjet is almost normal. But the upper and lower incisor are proclined. From cephalogram analysis, we can see NB angle almost 8 degrees. That means patient is still class 2 malocclusion. And also we can see upper and lower incisor proclined. Panoramic show the patient for wisdom teeth are present. And then we put the brace on. We use the natural wire to start to align the teeth, and also use the test to reinforce the anchorage. This is after several visits. We use the wires, natural wires, continue to align the upper and lower arches. And this is rectangular natural wires. You can see the teeth just move back with the ligature wires. So this is the final treatment. You can see here. The patient have a nice profile, street profile, and also the front view. We can see the patient, the upper lips get normal. And intraorally, you see the midline is on, normal overbite, overjet. Molars are class 1 on both sides. And arch form, pretty good. So the invisible aligners change the way how the patient come to see the orthodontist. Because with the Invisalign, with the invisible aligners, we also book the patient in 2 to 3 months. That means we reduce the appointments for the patient. And also we can reduce the emergency visit. Because with the traditional wires, the patient, when the brackets came off, the patient have to come to the clinic for emergency visit. And also we can go, we can do a flyover for the appointment. So this is a young lady, 21 years old female with a street profile. And when she smiles, we can see midline is almost on, but we can see the canine still out a little bit. Intraoral, we can see on the right side, class 1 molar. On the left side is class 1 molars. On the right side is full class 2 molars. And also the canine is stick out. And if intraoral photos, you can see painted as a severe crowding and upper arch, and moderate crowding and lower arch. This panoramic shows the lower eighth, the freedom teeth, the wisdom tooth are horizontally blocked in the arch, impacted. And what we did for this patient, we just remove one premolar as 1/4 and use the segmental wire from the canine to the first molar. And we try hard to pull the canine into the arch. It takes almost about 3 months. 3 months, we can see the canine almost in the arch. The severe crowding was eliminated. And on the other hand, on the other side, left side, then almost no change. And then we remove all the brackets. And start to do the clean check for the patient. So we use the aligners, try to bring the canine in to eliminate the crowding at the upper arch. You can see here, upper arch. After we remove the first premolars, we align the arches, and on the lower arch, we give it a stripping from canine to canine. Try to straight lower arch. This is before refinement. You can see the patient have maintained a straight profile. The profile not changed. And the midline is almost on. And intraorally, we can see the canine move into the arch already. And the canine and the midline maintain on. And also left side molars class 1. Intraoral photos, we can see how we the teeth parallelism is doing pretty well. And then we did the refinement for the patient. We tried to make the biting a little tight. And this is almost final treatment. You can see the midline is on, normal overbite overjet. And the right side class 2 molars, left side class 1 molars. This is from beginning to the end. You can see how the teeth move. And right side molars class 2, full class 2. Left side maintain class 1. So from this patient, we can see with the aligners, we have a lot of benefit. Or even the patient went abroad for studying. and he hasn't come back for visit in 1 year, but still the patient wear aligners very well, and the result is pretty good. The invisible aligner has changed the orthodontic treatment more invisible and more comfortable. This is a 16 years old female. You can see patient has protruded upper jaw and restrict mandible. And when he smile, we can see the crowding and arch. Intraoral, we can see the 1-2 was parallel position and rotated the canine and the incisors. Lower arch, we can see the decayed teeth. And lateral occlusion, you can see pair of calcium molars. And from anterior segment, you can see the pair of H8 position of upper and lower teeth. So this is a cephalogram, panoramics. And then we remove 4 teeth for this patient. And we have this clean check can show us how we move the teeth. And we can see how we rotate the tooth. This is in progress. You can see the teeth are moving. The canine move back, and also up both the top and the bottom arches. This before refinement, we can see the patient have changed a lot. The profile is getting much better right now. And intraorally, you can see the both sides, the molar class 1, and the arch form pretty good. And also normal overbite, overjet, midline is almost on. This is final result. You can see how big change the patient profile. And intraorally, I think the occlusion is pretty good. And before and after, you can see how nice the patient profile it is. A closer view of the arch, you can see severe crowding of lateral region area, and then after invisible aligners, the arch was aligned very well. So this is a intraoral photos. You can see how nice movement with the aligners when we treat the patient. The invisible aligner has made the opportunity for those patients who couldn't receive the orthodontic treatment with conventional braces. If the patient has a very bad oral hygiene, so it's very hard to use the metal braces, and then the patient cannot brush the teeth well, and the teeth are getting the decalcification will getting worse, even a lot of decay. And also we have some patient with the bad situation of enamel. So this is a 13 years girl. You can see patient at the front view of the face. You can see the chin shift to the right side because of an asymmetric face. And lateral profile shows protruded upper lips. And intraorally, you can see the unilateral crowding at right side and severe crowding at the upper arch, moderate crowding at the lower arch. Midline is off, and also the molars are calcified on both sides. This is a panoramic. What we did for this patient, we use aligners to treat teeth at the upper arch, and we did some stripping. And for lower arch, we just remove one lower incisor. We can see how fast the teeth moves. This is in progress. You can see the molars class 1 on both sides, midline a little bit off, facing, and then we continue to the treatment. Unilateral crossbite is eliminated. The midline is almost on. Other side, molar canine almost class 1. Well-aligned upper and lower arches. So this is the photos after treatment. We can see how nice changes of upper and lower arches, and also facial profile. So even the asymmetric face getting better, much more better. So you can see how the teeth move at the front view of the teeth. How we can move the teeth from beginning to the end. Other side, unilateral crossbite was eliminated. This is another girl is also 13 years old. You can see patient has a slightly convex profile, and intraorally you have a severe crowding in the lower upper arch and a moderate crowding in the lower arch. You see the lateral, upper and lower lateral incisors were parallel to a lingual position. Canine is block out. So panoramics show the wisdom teeth are developing. So this is a clean check. You can see how can you move the teeth. You can see how big changes of the teeth, the arching form. So this is in progress mass photo, intraoral photo. You can see the canine move back, lateral almost out. Continue the treatment. The oral hygiene still not good, but compared with the traditional braces, is much better. This is before MCC. We can see the patient profile change a lot. Midline is almost on the some dental occlusion is not as good as we expected. So we did we can see the clean check, how we move the teeth. And then the teeth is getting straight and more straight. From beginning to the refinement, molar maintain good relationship on both sides. The removable aligner has made the orthodontic progress more easily compared with conventional braces. This is a 14 years old young lady. You can see patient is protruded upper jaw and the retruded mandible. Intraorally, we can see the patient has a moderate crowding at upper arch and mild crowding at the lower arch. Molars are class 1 on both sides. This cephalogram shows protruded upper and lower lips, and the panoramic shows 4 wisdom teeth are present. And what we did for this patient, we just removed 4 teeth. And then from the clean check, you can see we used the visible aligners. Start to align the arches simultaneously, start to retract the front to the back. Compared with the traditional braces, we need to straighten the teeth first, and then we retract the front to the back. So the invisible aligners is much more convenient compared with the traditional braces. This is after 43 stages, and almost 43 weeks later, we can see the upper arch, lower arch almost straight. and the extraction gaps space is getting much smaller. So we continue the treatment, and then you can see the space almost closed. And this is after the before refinement. After align upper and lower arch, you can see how when patient smell, how straight the teeth, and also profile is getting much improved. Intraorally, you see here, nice arch form, and middle a little bit off. And then we did the refinement for this patient. Use the smart force attachments, can just rotate the molar. You see here, and then upper, and finally we can see the patient after treatment. Patient has nice profile, and the intraorally the occlusion is pretty good. The midline is on, normal occlusion, normal overjet, molars Cas1 on both sides, well aligned upper and lower arches. So this is after treatment the cephalogram and the panoramics. You can see the root parallelism is pretty good. So the before and after, compared with the profiles, I think the invisible aligners achieved the very good result. And also the close and intraoral photos, you can see how nice the occlusion and how nice arch form, and also how well the alignment of upper and lower arches, and the midline changes, and the overbite, overjet, the change normal. The invisible aligners made the tooth movement more precise each step. Actually, this is a 21 years female. We can see patient also has a protruded upper jaw and a neutral mandible. Intraorally, we have a modern cornea at the upper arch, and also modern cornea at the lower arch, and the rotated teeth at upper and lower front part. So cephalogram and panoramics. So what we did, we removed 4 first report premolars. We can see here, according to clean check, we can move the teeth actually very precisely, especially for the cording cases. We can eliminate the cording very easily, and also for the rotation teeth, we use the aligners very precisely. We can rotate back and derotation the upper and lower anterior teeth. So this is the in progress photos. You can see how involve aligners to straighten upper and lower teeth. You can see the front teeth is getting more straight and more straight. This is before the refinement. The rotated teeth almost straight already, and I made it a little off. The molars a little bit cast too, and then we did the refinement for the patient and do the final. We can see the final result. Patient have a nice profile, nice smile, and the intraorally have a nice occlusion. Both molars are class 1, and the midline is on, and the normal occlusion. You can see actually with the invisible aligners, the teeth can move very precisely and more efficient. This is the intro after treatment cephalogram and the panoramics. Nice parallelism. Before the profile changes, before and after, and the front smell, you can see nice smell after treatment, and the occlusion, you can see how we rotated the teeth, derotation of the teeth, and the molars class 1. The invisible aligner has made the face changed. Here's a 26 years old female. You can see the patient has a convex profile, protruded upper jaw, and retracted mandible. And also when she smiled, she showed too much gum. That's the severe gum smile. And when she closed lips, you can see here chin area is very tension, you know. So this the molars are class 1 on both sides, in the crowding at the upper and lower arches. Increase overjet and overbite, increase overbite. So the four wisdom teeth are present. And what we did for this patient, which is remove 4 first premolars. We try hard to reinforce the angle and retract the front back as much as we can. And this is in progress. Here we can see how patient the gum smell is getting improved, and the upper jaw retreat a little bit back, and also the mandible getting a little bit forward. So intraorally, we can see all the crowding are eliminated, and we can see we use the test to reinforce anchorage, and we did very good vertical contour of the anterior teeth. Overbite is pretty good. And this is after we do the first, wear all the aligners before the refinement. We can see the patient profile is getting much improved. The upper jaw, protruded upper jaw is retracted back. The mandible, retracted mandible is getting much improved. The gum smell is getting much improved. So this is the intro view. So and we did but still you can see the teeth some of the tilted, and then we did the refinement. This is a cephalogram, and after refinement, you can see how nice occlusion the patient we achieved. The normal class 1 molars and class 1 canine, normal overbite, overjet, profile getting much improved. The patient are so happy with the result. Also, we are happy too. You see this before and after. And so, as we know, the yellow aligner may change the life of our orthodontists. Therefore, all of us have to try to seize the opportunity to be one of the best orthodontists, to treat the patient well, and we can get a nice, achieve the better result. So invisible aligner is our near future of orthodontics, especially the digital orthodontics is getting more popular, and the invisible aligner, I'm sure, will much popular in near future. Thank you for your kind attention. Thank you.